So my name is Mona Duncan, and I'm one of the general surgeons here who specializes in breast cancer. I love to operate, and so that was a quick draw to surgery, and I'm lucky. I actually have amazing patients, so I think the biggest draw to breast is every single patient I see is someone's daughter, mother, sister, and just to feel that connection and that we're making a difference, not just in their life, but in the lives of everyone that they touch. It's really, it's what I love doing, absolutely. A lot of people who come in here, there's a lot of uncertainty. You've been diagnosed with cancer. You don't know what you're going to be doing. You don't know what your prognosis is going to be. And it is a lot easier when you have a focus. I need to get through this. My surgery is in 2 weeks. The recovery will be 2 weeks. Then I'm going to have radiation for a month. Then we're going to be on this. And so I really think that understanding the reason behind the plan makes people more comfortable with it and more adherent to it. And also understanding that we do a great job with breast cancer. Our cure rates, our survival rates are excellent. And so even though you're coming in with a cancer diagnosis, the goal is likely that you're going to be doing fine. So we need to do what we can for you so that you're still happy and healthy in 5 years or 10 years following your diagnosis, or hopefully 20, 40, 50 years following your diagnosis for some of my younger patients. It's hard being a patient. Unfortunately, I've experienced that on the other end. And it is very different when you feel that there's a doctor who understands and who is there to help. I had an episode of time a year ago where I got sick, and we couldn't really figure out what was going on, and for thankfully a very short interval of time, thankfully only about 3 weeks, I actually thought I was dying from pancreatic cancer. Thankfully it was a short period of my life until I figured out I of course had some very rare autoimmune thing that, that's uncommon. So I was fine, but it just really made me realize how hard it is when you're waiting for that CAT scan, and it's another week for your MRI, and it's another week till you see somebody else. And that anxiety during that process can be crippling sometimes. So you just have to deal, and you have to, take one step forward at a time. And as soon as you have a diagnosis and a plan, it really makes a difference. So outside of work, my family's my life. So I'm blessed. I have 3 beautiful daughters who are ranging from college to middle school. One about to go to college, one about to graduate college, and they're the biggest joy of my life. Absolutely. Outside of family, I love to read. I have a dog, 4-year-old, who's a sweetie. So taking the dog on a walk. I think those are the things that bring me the most joy. There are a lot of things that Geisinger does well. If there is something new that is out, if we are capable of trying it, then they are fully supportive. I think that support to constantly be supportive of innovation, supportive of new techniques, supportive of bringing in new equipment when it's needed for new techniques. Geisinger does that really well, and it allows us to just constantly be improving, which is what we want to do in medicine and as people. It's what we want to do.